Low versus High Carbohydrate Diet in Type 1 Diabetes, 12-week randomized open-label crossover study. Aims to compare the effects of a low-carbohydrate diet, LCD, 100 grams carbohydrate day, and a high-carbohydrate diet, HCD, 250 grams carbohydrate day, on glycemic control and cardiovascular risk factors in adults with type 1 diabetes. Materials and methods. In a randomized crossover study with two 12-week intervention arms separated by a 12-week washout, 14 participants using sensor-augmented insulin pumps were included. Individual meal plans meeting the carbohydrate criteria were made for each study participant. Actual carbohydrate intake was entered into the insulin pumps throughout the study. Results: 10 participants completed the study. Daily carbohydrate intake during the two intervention periods was mean plus or minus standard deviation, 98 plus or minus 11 grams and 246 plus or minus 34 grams, respectively. Time spent in the range of 3.9 to 10.0 mol. Primary outcome did not differ between groups. LCD 68.6 plus or minus 8.9% versus HCD 65.3 plus or minus 6.5%. P equals 0.316. However, time spent, 3.9 mol was less, 1.9 versus 3.6%, P 0.001, and glycemic variability, assessed by coefficient of variation, was lower, 32.7 versus 37.5%, P equals 0.013, during LCD. No events of severe hypoglycemia were reported. Participants lost 2.0 plus or minus 2.1 kilograms during LCD and gained 2.6 plus or minus 1.8 kilograms during HCD, P equals 0.001. No other cardiovascular risk factors including fasting levels of lipids and inflammatory markers were significantly affected. Conclusions. Compared with an intake of 250 grams of carbohydrate per day, restriction of carbohydrate intake to 100 grams per day in adults with type 1 diabetes reduced time spent in hypoglycemia, glycemic variability, and weight with no effect on cardiovascular risk factors. This article is protected by copyright. All rights reserved. This article is protected by copyright. All rights reserved.